All right. Okay, well, depending on how you cut this off, I'm going to get started. And I'm going to start by sharing my screen here. But before I get into it, I am going to start by giving a couple examples and explaining why healthcare in the US is so important and just why insurance is so important. So, are you seeing the Lewermark website right now? Would you mind giving me a
Yes, we are.
thumbs up
We
just
see
to be
it.
sure? Okay, perfect. All right, so just to give you a couple examples, um, if, and just think about this in your head, think about the answer. If you were back in your home country and you broke your leg, you were in an accident and you broke your leg, you went to the emergency room to get care, you got a cast, you had follow-up appointments. How much do you think you would pay for that visit, the visit to the emergency room, seeing the doctors? Uh, just kind of think about that in the back of your head. And some of you may be thinking, oh, $100, maybe $50. A lot of people will say $0. They can go to the emergency room and um, they're not going to have to pay for getting that broken leg fixed. Here in the US, that is very different. The average cost of an emergency room visit for a broken leg is anywhere between six and $10,000. And that's not including if you were to need surgery for that broken leg. Surgery could be anywhere between $30 to $50,000, which is just an absurd amount that, and none of us can pay that out of pocket. So that's where insurance steps in to help pay those bills for you. I'll give you another example. We had a student a couple weeks back who had appendicitis and needed their appendix taken out. It's a fairly routine procedure. It can happen to anybody. And when they went to the hospital to have this procedure, they forgot their insurance card. They forgot to mention that they had insurance, and they were actively covered by us, but they didn't tell the hospital that. So they had the procedure, and a couple weeks later received a bill in the mail for $15,000 for this routine common thing. And they call us and they said, "Hey, I received this bill. What do I do?" And we said, "Don't worry, we're on it." So we called the hospital, we got their insurance information on file, and the student ended up paying less than $100, and insurance covered the remaining balance. So instead of paying $15,000, they paid less than $100, and that's using their insurance. So not only does that explain how expensive and complicated things are in the US, but it also explains the importance of getting your insurance ID card and carrying it with you. All right, so I'm going to do this presentation by walking you through our website, just because you can follow along. Everything that I do today, you can do back on your computer. So this is lewermark.com. This is our home page where you can find all the information. Two important buttons that I really want to point out are Find a Doctor and ID Card and Claims. You're going to see them multiple times while I'm presenting today, and it's because they're so important. First, you're going to need to find a doctor that works with your insurance, whether that's for a normal appointment, a regular checkup, or if you're not feeling well, you need to find a doctor. Next, when you're scheduling that appointment or when you're going in for that appointment, they're going to ask for your insurance information. So you're going to need to show them your ID card. And I'm going to do this first. I'm going to walk you through how to get your insurance ID card. So there's two ways you can do this. First is going to student login, or you can click on ID card and claims. And it will take you to this screen. Oh, we're going to close that for now. And if you're new, you've never created your account before, you're going to want to click this toggle to select I need to create a login and scroll down And all you need is your birthday and your student ID number. Notice the birthday is in a weird format. The Americans format their dates different than the rest of the world. So it's month and then day and then year. And then your student ID number is going to be a 9-digit number. So if your ID number has letters in it, you're just going to take those letters out. If it's less than 9 digits, you're just going to add zeros to the front. So, for example, I had a weird student ID number when I was in college. It was M796R449. Okay, so I said it needed to be a 9-digit number. That's not 9 digits and it has letters in it. The system will autocorrect that for you. So you shouldn't have any issues, but if you do, maybe just double check that format. But what I mean by autocorrecting is it will take out those letters and add zeros to the front. And then you can click login. When you click login, it will ask you to create a unique password and answer security questions. Now, once you've created your account, you can log in using that unique password and your student ID number anytime. Again, this is how you're going to get your ID card. You can check on any claims status. If you ever need any help getting your ID card, if you have questions about how to find a doctor, if you get a bill in the mail that you don't know what to do with, reach out to our team and we're more than happy to help you with that. You can call us, you can email us, or you can chat us. On every single page of our website, there's going to be this chat feature in the corner. You can use that chat feature and it will connect you to a member of our team live that's here in the office that you can chat with in real time. So that chat feature is a great way to get in contact with our team. All right. I'm going to go back to our home page. So this, again,
Hey,
this is
Maddie, can I ask you a question real quick?
absolutely.
Is what hours is the live chat active or populated?
Yeah, the live chat is going to be available between 8:30 a.m. And that's Central Time. We're in the same time zone as you, and 5 o'clock p.m.
Okay, great.
Monday through Friday.
And I do direct a lot of our students to that because I think it's instantaneous. It's always great help. And then if they're trying to do it afterwards, it would send an email, correct?
Right. Yeah. Even if you chat in after hours, we'll still get that sent to our emails and we'll contact you back.
Okay, thank you.
Yeah, of course. Good question. And I'm on that chat feature sometimes too. So if you ever see me pop up, you're welcome to just say hi and um, let me know you're here. All right. So we're back on the home screen. Again, this is lewermark.com, and you have a dedicated school webpage that will allow you to access all of your school specific information. So if you start typing it in and click on your school, you know you're in the right place when you see the logo pop up. If you scroll down, again, here's all of our contact info. You can call, you can email, or that chat feature. So here we see those two important buttons again, print your ID card and search for a doctor. Um, Print your ID card, that's going to take you to the student login that we just walked through. And we're going to go through search for a doctor here in a little bit, but I'm going to point out a couple more things before we get there. Here's the purchase student insurance button. If you guys have not already purchased the plan, you can do that on our website by going to this button right here, and it will ask you for your information, and then you can pay through the website. If you ever need any help walking through that purchase portal, reach out to our team and we can walk you through that as well. I'm going to open up this plan summary and explain a little bit about the benefits of your plan. This plan summary is just a one-page breakdown of what's covered on your plan. And there's probably some terms on here that you may not understand, and that's okay. We're going to walk through it. So, the first thing I want to mention is the CVS walk-in clinic right here. Lewermark has a partnership with CVS walk-in clinics where you can visit a provider and you can be seen at no additional cost to you. Notice over here, CVS walk-in clinics are paid at 100% with a $0 copay. That means you won't pay for that visit as long as it's a covered benefit. All right, the next thing I want to point out on the summary is the wellness benefit down here. So you have a wellness benefit on your plan where you can get preventative care paid for up to $300 per policy year. So if you want to make a routine appointment, if you want to get your annual checkup, a well woman exam, immunizations, vaccinations, any sort of preventative care like that will be covered at 100% up to $300. So again, that copay will be waived. Now I'm going to go through this information right here in just a little bit. I think it'll make more sense when I describe how to find a doctor and the different types of visits that are available to you. All right. And if you do have more detailed questions about what's covered and what's not covered, we do have a plan brochure right here. However, this plan brochure is about 30 pages long, and we don't expect you to read or memorize the entire thing. It has a lot of great information in it that you can reference as needed, but if you do have specific questions, you can also reach out to our team and we can explain the benefits as well. But I want you to know that this plan brochure is here in case you did want to look through it. All right, now I'm going to go to search for a doctor. I'm going to show you how this feature works. When you go to the doctor, when you go to an appointment, when you're scheduling an appointment, and they ask you what insurance you have, you're going to want to say, my network is Aetna. So you can tell them that your insurance is through Lewermark. However, they may not recognize that name because we use the Aetna network of doctors. So again, when you're scheduling an appointment or you're checking in for an appointment, say, my network is Aetna. That's what you're seeing in those purple letters. We're going to go to find an Aetna provider. And you can search by your area. So the Aetna network is nationwide. So if you're traveling for spring break, if you're visiting friends on the weekend, or if you're going somewhere over the summer, this this network works all across the nation. So all you need to do is enter your zip code or your current city that you're located in. I'm going to use your zip code to find local providers. And it's going to ask you to select a plan. Don't let this part confuse you. You can select either of these options to find doctors near you. You have access to both of these networks. What I recommend is selecting Passport to Healthcare Primary PPO Network and selecting Continue, looking at doctors in your area. And then if you would like to see additional options, coming back to this page and selecting Secondary, um, I just want you to know that you can select either of these. Okay, and then it's going to break it down into different categories depending on the type of visit that you want. So, if you want to find a primary care physician during your time here in the US, a doctor to see for routine appointments, you can go to medical doctors and specialists. Remember that I also brought up CVS Minute Clinics. Those are a great way to keep costs down since we have that partnership with them. If you want to find a CVS Minute Clinic or a walk-in clinic near you, you can go to walk-in clinics. All right. There's also an urgent care option. Urgent cares are great places to go if things are a little more serious, but a not life or limb threatening. All right. Hospitals and facilities. So this is important information that uh, is different here in the US than it is in a lot of other countries. Hospitals and emergency rooms here in the US are meant for life or limb-threatening injuries and illnesses. So they're meant for those very serious cases. Walk-in clinics and urgent cares are great places to go if you have a headache, if you have cold or flu symptoms, minor cuts, scrapes, burns, rashes. All of those instances, you're going to want to go to a walk-in clinic or urgent care center. Now, if you break your leg or if you got a concussion, if you're having trouble breathing, those are all good examples of when you would go to the hospital or emergency room. All right, I don't want to jump around too much, but I'm going to go back to our plan summary. Notice on here it's broken up into types of visits. So again, CVS walk-in clinics are paid at 100% with no copay. Now, if you go to an office visit, if you schedule an appointment with a doctor at their office, you will have a $20 copay. If you go to a hospital or emergency room, you will have a $100 copay. So a copay you can think of very similar to a ticket. It's an amount you're going to pay for that specific visit. So if you schedule an office visit, you'll have a $20 copay and the remainder of the bill will be paid at 100%. If you go to a hospital or emergency room, you're going to have that $100 copay. So again, it's a lot more money because those are meant for those life or limb-threatening injuries and illnesses. All right, so to continue this example, I'm going to look for primary care physicians in your area. Say I want to schedule an annual exam. I'm going to go to primary care physicians, doctors, primary care. I'm going to find everyone that's near you. This will pull up a list of providers in your area. And one neat feature I want you to notice on here is the filter and sort button. So we want you to be as comfortable as possible getting medical care, getting the care that you need while you're here in the US. So if you're more comfortable than a female doctor than a male doctor, you can select that here. Or if you want to find somebody that maybe speaks your native language, there's a few options in your area as well. Whatever makes you the most comfortable with getting the care that you need. All right. And that's how you would search for a doctor in your area that uses the Aetna network. If you need help finding a doctor, you can also reach out to our team and we can send you a list or help find someone near you as well. Okay, any questions about using that portal or finding a doctor? If not, I'm gonna keep scrolling down a bit. And there's more additional information down below. So there's what we call ancillary services, and those are services available to you, again, at no additional cost. So we're going to walk through them now. First is Teledoc. Now, this is a free virtual app that you can download and speak to a doctor 24/7. So this is a great option if you're lying in bed, you can't go to class, you don't want to go to a CVS Minute Clinic. You can open this app and talk to a doctor while you're laying there in bed. It's great for headaches, cold and flu symptoms, rashes, allergies, infections. And it's just a great first place to visit, even if you don't know what's wrong, because again, it's no additional cost to you. So if you're not feeling well, you can talk to a doctor, and then if they feel it's more serious, they can refer you somewhere else. I highly recommend as soon as you get logged into your Lewermark student account, downloading this app and registering your Teledoc account. That way, whenever you are sick, this is available to use. All right. Next, we're going to go to contact a mental health counselor. And this is going to take us to TELUS Health. And again, this is another free virtual service to talk to a mental health provider 24/7. And it's available in 5 different languages: English, Spanish, French, Cantonese, and Mandarin. They also have over 140 other languages available. You may have to make an appointment in those languages, but you can see someone within a couple of days in those languages. All right, this is great for if you're experiencing homesickness, if you're going through a breakup, if you have school stress or you have exams coming up and you want somebody to talk about it with, you can go on to TELUS and talk to a mental health provider about what you're experiencing, about what you're going through, and they can help you. All right, while we're talking about mental health, I'm going to go to Togetherall. And this is another mental health website, and it's more of a social media platform where you can get on and make posts. You can comment on other people's posts. It's monitored by mental health professionals, and it's a way to find a community of people who are going through similar situations as you. Coming here to the US to study is incredible, and you have so many people that are proud of you and here to support you, and it's also going to be incredibly hard at times. Um, but you're not going through this alone. There are a lot of other people out here going through similar situations, and you can find a community and talk about your experiences using Togetherall. All right. Next, I'm going to talk about Scholastic Emergency Services, or SES. And this one is not fun to talk about. This is for those very serious situations, but it's incredibly important. If you don't understand anything that I um, say today, I hope SES sticks with you, and I hope you remember this information. This is for compassionate family visits, repatriation, and medical evacuation. What that means is if you were in an accident and in critical condition and in the hospital, and say you're in the hospital for an extended period of time, like more than 5 days, Scholastic Emergency Services will help get a family member here from your home country. They'll pay for it and arrange the flights to get the family member here to stay with you while you're in the hospital, and then help them return back to your home country. If you were in an accident and you need to return to your home country to continue receiving medical care and you can't continue your studies here in the US, they will help get you back to your home country using medical assistance. And worst case scenario, um, if a family member were to pass away during your time here in the US, they will help get you home, get you back to your home country to mourn with your family and then return to your studies here in the US. Or if you were to pass away during your time here, they would help get your remains back to your home country in a respectful manner, depending on what that looks like culturally. And they would work with your family to figure out what that looks like for them. Now, the key with SES is that they do not reimburse. They have to be contacted first. They know customs, they know visas, they know how flight arrangement plans work. They are good at this. This is what they do. So they have to be contacted first to start making those arrangements. If you're in the hospital and a family member starts buying plane tickets, SES can't reimburse for anything that's already purchased. So to contact SES, you can either let us know, reach out to Lewermark, and we can help walk you through the process. Or if you want to call or have a family or friend call here in the US, you can use this top number up here. We highly recommend you give this number down here to your family member, your family back in your home country. That way they can communicate with SES to start to make arrangements if they need. All right, those are the additional services that are available to you. Again, those were Teledoc, TELUS, Togetherall, and SES. If you have any questions about those, let us know. All right. And a couple more things I'm going to mention on this page is the dental and vision options. So here in the US, medical is treated separately from dental and vision. Those are two different plans here in the US. So your Lewermark plan is a medical only plan. If you would like a dental and vision plans, you can go here to this button and to our sister company, Lure Global, and get a dental and vision insurance plan. Also, if you came here to the US with a dependent, if you came with a spouse or a child or a family member is coming here to visit, they can get a medical plan through our sister company, Lure Global, as well, if they need coverage during their time in the US. And you can do that through dependent coverage options here. All right. I'm going to go back to our home screen here. I'm going to scroll down a little bit. I'm going to start to wrap up kind of on a fun note and with our Make Your Mark scholarship. Now, we offer a scholarship every fall and spring semester, and we just announced our winners for the fall scholarship last week. So you can go on here and look at our submissions and see who won, which is really fun. The prompt is different every semester, so there's going to be a different prompt than what there was last fall. But mark your calendars now for January 20th. Our spring scholarship is going to be released. So mark your calendars, come back to our website, lewermark.com on January 20th, and you can find our prompt and you can apply for the Make Your Mark scholarship for the spring semester. It's a fun way for us to um, get to know you, just because it usually has something to do with your culture or your home country or what you're studying. And we accept all types of mediums. You can do a video, you can write an essay, you can make a sculpture or do a painting. Um, we accept all different types of mediums, so do whatever's best for you. It seems like videos are usually the most popular option. All right. So I know that was a lot of information, um, but I want to kind of wrap up going over what we went through. Um, Download your ID card by logging into your student account. You can find a doctor. And you have a dedicated school webpage that has all of your plan specific information on it. It also has our contact information on it. So if you have any questions about your plan, how to find a doctor, if you get a bill that you don't know what to do with, reach out to our team and we can help with that. All right. I believe that covers everything. Is there any questions or anything that you would like me to go over again?
Don't see that any other students have joined us, so I don't have any questions unless Brooke or Osita have questions that maybe could be addressed.
Yeah, or anything that I can clarify a little bit further.
Nothing from me. Thank you.
All right. Yeah, you're welcome. Um, and again, if you do want me to hop on and do um, like either a Q&A or another orientation with students, I'm happy to do that. But
Yeah, so
Yeah,
we've recorded this, we'll put this online, we'll make this available to people, and we will follow up with another session maybe later in the semester.
awesome. Cool. Well, sounds good.
Okay, great. Thanks,
All
man.
right. Yeah, of
Appreciate it.
course. Yeah, nice talking to you.
All right,
See you
have a
soon.
good day.
You too. Bye bye.